Here are the facts. A 23-month-old child was transferred to Texas Children's Hospital on April 14th from Brownsville, Texas, where he was visiting from Mexico City, which is his home, with his family. He was transferred to Texas Children's Hospital via medical transport and was critically ill upon arrival at Texas Children's Hospital. Appropriate infection control measures were taken during every time of his hospitalization. Samples were sent to the Centers for Disease Control for confirmatory testing on April 28th, and we received confirmation of H1N1 flu from the CDC very early this morning. The family has shown no symptoms of illness of any kind, either during hospitalization or subsequent to hospitalization. Texas Children's Hospital is carefully monitoring all of the physicians, nurses, and any other healthcare providers who've been involved in this case, and none of them have displayed any symptoms of H1N1 influenza at any time. And we are continuing to monitor them as well. We want to emphasize that we do not think this case should trigger any undue alarm in our community. This child did not acquire this virus in Houston, Texas. The larger message that we really want to emphasize today is that we in Texas, and we in Houston and in Texas Children's Hospital, are really in a preparedness mode right now. And that we urge everyone to take a very simple set of recommended measures to protect your own health and the health of others, including your family. In essence, everybody needs to be their own infection control officer. And this means taking several extremely simple general steps. To make sure you cover your nose and your mouth with a tissue when you sneeze or when you cough. Throw the tissue in the trash after you use it. Wash your hands either with soap and water, especially after you cough and sneeze, or use alcohol-based hand cleaners, which are also extremely effective. Avoid touching your eyes, nose, or mouth if you can help it, because this is a way that germs spread. Try to avoid contact with other ill individuals if possible. And if you or your child is ill, please call your primary care physician for instructions. And let me note that these are not only the general measures we would take with any particular illness, but there is every reason to believe that general infection control measures should help to prevent at least some measure of the spread of this as any other virus.